Hi, my name's Emily Cerda. I'm a microbiome specialist here with Tiny Health. Today, I'm going to talk to you about infant and toddler Bifidobacterium and HMO digesting species. This is a really important topic for both infants and toddlers as far as their growth, development, immune maturation, really gut maturation overall goes. So let's go ahead and dig in. Today, I have for you baby Nico. We can see this test. At this test, he's 7 days old. That is a little early to run a test, and I think we'll see that reflected here. Usually we say anywhere like at least 10 days, maybe 14, 21 days. You might get a fuller picture of some of the beneficial bacteria starting to come in and colonize baby's gut. So here for baby Nico at 7 days, I'm going to go down to the See All Metrics button, big purple button, and we're just going to start with the first two metrics here in immune strength. So the first is Bifidobacterium. Bifidobacterium is very, very important for infants and toddlers. You can see that for infants, they need to have 80 to 100% of their gut as Bifidobacterium. That is the ideal range. You can see here for baby Nico at 7 days has less than 1% in the gut. So over time, and we will look at a couple of these kits, you'll be able to see like where your patient progresses or look back as it is to see where they've come from. Down below, again, you can click in to learn more about Bifidobacterium, how important it is really to keep a good balance in the gut because it does lower the pH of that gut environment to keep some of these unfriendlies out. We know that certain strains of Bifidobacteria actually help babies to digest human milk oligosaccharides or HMOs. Those are special sugars found in breast milk, complex sugars. And without those, sometimes there can be some immune dysregulation or even some issues with digestion itself. And then bifidos are very, very good at supporting the immune system. So down below in this bifidometric, you will be able to see the species in the sample for the individual. So we can see here, baby Nico at 7 days has 4 species. And we'll learn in a minute that these top three are HMO degraders, but this bottom one is not. So overall, just looking at Bifido, I think a huge action step for this baby will be to either breastfeed or to colonize some bifidobacteria up to about that 80% mark. Now, if I back out of the bifidobacteria, HMO digesting species really goes a little bit deeper into the bifido types. So here, again, HMO digesting species are types of bifido. If we scroll down, you will see the 4 types. So we have infantis, breve, bifidum, and longum as the 4 species of bifidobacteria that will help to break down those HMOs or complex sugars. And again, you can click in here to learn more about that if you need to. We want to have some good associations here with having 60% or more of the gut as bifidobacterium, as HMO digesting bifidobacterium. So that's these 4 types. If we scroll down for baby Nico, we can see only those top 3 types of bifido are listed here because we're only listing the HMO degrading species of bifido. Now, again, you'll see the actions to the side, and so maybe we're going to use a bifido probiotic, or maybe this baby is breastfeeding and they are 7 days at this point, so that has not quite colonized. I am going to back out to baby Nico's original results page, and I'm going to go fast forward to his result at 6 months. So at 6 months, I'm going to go again into See All Metrics. We can see that things have shifted. Okay. For Bifidobacterium, now still like 83% to 100% of the gut should be Bifidobacterium at this age. And so he's at 67%. So that is this sample right here. Now, if I scroll down, we can see what has colonized. So we do have some breve. That is an HMO digester. We have some longum. And then down here we have infantis and bifidum. So there are HMO digesters in there. And probably at this point, I would be asking questions around immune, how this baby is presenting with immune and digestion, and all of those things to see if we need to boost this bifido a little bit or not. Bifidobacterium, I like to call it beef or bossy. It's really good at getting in there, and because it makes lactate as a byproduct, it does shift the pH of the gut to be more acidic and make it a place for unfriendlies. They just don't want to thrive there. So if this baby had maybe this amount of bifidobacterium and they had some unfriendlies that we could crowd out with a little bit of bifido, provided we have that space, then we would probably use a short course of the bifidobacterium. Bifido is one of those probiotics that we're careful with here at Tiny Health because it is beef or bossy. And that means that if we continued to use it as a supplement, as a probiotic for too long, it would be happy to take up space and to colonize as much as you'd let it. And the problem there becomes here at 6 months, baby Nico is probably starting some solid food, going to start to have some fibers and some different things in those solid foods that are going to promote different types of bacteria in the gut. And that's natural diversification and natural maturation of the gut microbiome. If we say pushed bifidobacterium up to 100% and then kept taking a probiotic for bifidobacterium, that bifido would be happy to sit really, really high like that. But baby Nico wouldn't have any space in the microbiome to start to develop the diversity that we'd like to see from the solids introduction. So, like I said, bifido is one of those that we put a timeline around as far as using it as a probiotic. Okay, if I back out here, so we looked at bifido, there's a little bit of space there. HMO digesting species, to contrast, now need to have 50% or more they need to take up 50% or more of the gut. So here, baby Nico is looking very good. If we scroll down, again, we can see those types. And this is neat because strains have been detected that are related to some specific products. So you can see this Breve BB45 is actually in the Dr. Green Mom product. And maybe that's something that the patient's family has been using for them. So interesting conversation there. So that is Bifidobacterium and HMO digesting species. Remember that HMO digesting species are just specific types of Bifidobacterium that are really important for immune health, for digestion, so that they can break down these HMOs that are in breast milk. And they can grow and develop from that. Okay, I hope this is helpful.